Welcome to another Dr. 2 Health Mastery series. Today we'll be talking about polycystic ovarian syndrome. Before we get started, most of you that watch my video are not actually subscribed to my channel. Please subscribe, like, share it with your friends and family. It really helps me to make more of these videos. A diagnosis of polycystic ovarian syndrome is made when 2 out of 3 of the following exist. 1. An infrequent or irregular menstrual cycle. This is usually classified as menstrual cycles that last longer than 35 days, or a single menstrual cycle in a calendar year that lasts longer than 90 days. Secondly, clinical or biochemical signs of excess androgens. These are the testosterone-like hormones that I mentioned, and we'll talk about the symptoms that this can cause in a little while. Thirdly, excessive ovarian cyst, known as polycystic ovaries. On transvaginal ultrasound scan, girls and women who have never been sexually active are recommended to have transabdominal ultrasound scan. It is worth stating that polycystic ovaries in themselves do not confer a diagnosis of polycystic ovarian syndrome. In fact, about 25% of women have polycystic ovaries. When it comes to making the diagnosis of polycystic ovarian syndrome, it is important that other conditions that can also cause these symptoms are firstly excluded. As a result, polycystic ovarian syndrome is a diagnosis of exclusion. Some of the conditions that often need to be excluded are, for example, underactive thyroid, otherwise known as hypothyroidism, excessive prolactin secretion by the pituitary gland in the brain, which can cause a woman to stop having periods or to have very infrequent or irregular periods. Another condition that is not so common is something known as Cushing's syndrome, which is related with excessive cortisol hormone secretion by the adrenal gland, and this can lead to insulin resistance. A transvaginal ultrasound scan is necessary to examine the ovaries for the presence of multiple ovarian cysts, as well as to examine the lining of the uterus, the lining of the womb. One of the consequences of not having a period for long periods of time, especially greater than 90 days, is an increase in the cellular turnover of the lining of the uterus, something known as endometrial hyperplasia, which can lead to endometrial cancer. On an ultrasound scan, the ultrasonographer can tell whether the lining of the uterus is thickened beyond the normal level. And if that is the case, then that particular woman would need to have a biopsy of the lining of their womb. When you present to your GP in the first instance, some of the tests that will be done will include checking prolactin level, doing a pregnancy test, because a common reason for not having a period for a long time, for up to 9 months, is falling pregnant. Thyroid function test. Underactive thyroid can also cause facial hair growth. We would also usually check luteinizing hormone and follicle stimulating hormone, as well as estrogen levels. An elevated follicle stimulating hormone is seen in someone who develops menopause, and menopause can develop prematurely. A woman who develops the menopause before the age of 40 is referred to as having developed premature ovarian failure. We also usually check the total testosterone level, as well as the free testosterone or free androgen index. This gives an idea as to the level of circulating androgen levels. In polycystic ovarian syndrome, we'd expect the testosterone level or the free androgen index to be slightly raised. However, if the testosterone or the free androgen index is really high, this should raise the suspicion of a possible tumor that's secreting excessive testosterone. And this should warrant further investigation of the adrenal glands and the ovaries, looking for tumors that may be the cause of this. I mentioned earlier that a transvaginal ultrasound scan is done in women who have been sexually active in the past. The usual criteria for polycystic ovary is having at least 20 follicles in one or more ovaries. Now, if a transabdominal ultrasound scan is done, such as in a young girl or a woman who has never been sexually active, then the presence of 10 or more follicles in one or more ovary is diagnostic of polycystic ovary. So to put this all together, the criteria that is used to diagnose polycystic ovary is called the Rotterdam criteria. So having the presence of 2 out of 3 of excessive circulating androgen levels, infrequent or irregular periods, and polycystic ovary on ultrasound scan. Amongst women who are diagnosed with polycystic ovarian syndrome, 60% tend to have blood tests in keeping with excess androgen levels. Look, I hope this has been helpful to you. I look forward to seeing you again on another Health Mastery series. Please share it, like, subscribe to the channel so that we can keep doing more and more of this.
Audio Jungle.